Hi, my name is Dr. Ali. Welcome to Foreignmd, where we share stories and experiences of foreign trained medical graduates who were able to navigate the rigorous transition process at every level. These stories are meant to inspire and encourage you. Stay tuned. Hi, and welcome to another episode of Foreignmd. I'm so excited to have you on today. I have with me Dr. Esther Ufot, and so I'm excited to interview her today for today's episode. As you know, Foreignmd, we talk to foreign medical doctors who were able to successfully transition to practice in a different location from where they trained. And we talk about their experiences, their journey, so that we can be inspired. And you can also inspire another physician on their journey. So thank you, Dr. Nkem. Thank you so much. I'm glad to have you. So can you briefly introduce yourself?
Yes, thank you, Dr. Amiobe. Thanks for having me here. My name is Esther Ufot. I'm a family medicine physician. I'm a mom and a wife, and I'm currently in Atlanta, Georgia.
Okay, awesome. So where was your...
And then after graduation, my final year was a little bit very challenging for my set. We had a lot of issues as far as graduating is concerned.
Yeah.
So once we were done, 2011, I moved immediately to the US.
Okay.
And when I came in, I was like, okay, what next? That was when I started asking questions I should have asked. But the good news is I left immediately. I didn't do house job. I didn't do NYSC. I just packed my bag and I was done at that point.
Okay.
So at the mountain, I was like, what if they need house job? So we had no clue. I was like, I'll go back for a year and do it with the criteria. And my wife didn't. So we didn't have nothing,
Yeah.
Just bad planning on my part, Went on Facebook, found a couple of seniors who were in the US and I started asking questions. Prior to that, a lot of people gave me misinformation, but then I found the right people and I got the information I needed. I needed transcripts, of course. I needed I needed the ECFMG set, like all these others, they were all foreign to me.
Yeah.
The greatest challenge in my journey.
Yeah.
As people would say, is taking the boards and, matching. Mine was really that initial planning. I waited almost 2 years.
Oh, wow.
Trying to figure out what I was doing, So, and thankfully, I had colleagues here at school in Benin that were helping me, coordinate and getting those stuff done,
Yeah.
And and eventually I got all those paperwork. It was a lot. I'm sure you understand what it is to get back to school and, you have to water some dry
your transcript. Yes.
It was a lot, but, I got it done. And at that point, I was like, okay, there was a lot of stress, like I said, and then I started preparing for the exams after I got everything all sorted out.
Oh, wow. So you're looking at a process of almost 2 years now, trying to
exactly
figure it out.
So when I took step one, which was 2013, it was really more paperwork. I wanted to make sure everything was right. I wanted to make sure I filled everything that was needed, But in that process, I was gathering materials, I joined the USLME World. It was a community.
Yeah.
Very good resources, just trying to know what the exam was all about. And at that time, I got a job.
Okay.
Because I was bored. Again, it was just pure favor from God because I met this lady at my local church. She was a nurse practitioner, and then she introduced me to a family medicine physician who was looking for a receptionist.
Oh, no.
I was like, I would do anything. That is the right place to be.
Yeah.
And he was family medicine for a geriatrician.
Yeah.
Solo practice. So I was working there, I told him my dreams, my plans, and it was like, sure. So he was really very nice about letting me study while working in the office.
Okay.
I was doing everything from front desk to MA to billing and coding.
Oh, wow.
About the American healthcare system in that practice. I was doing the electronic medical record. Again, remember I graduated as a medical student.
Yes.
No practice whatsoever.
No doctoral practice. Yes.
Yeah. So that really prepared and helped me that 2 years. I worked with him up until I matched.
Oh, wow.
Was with that practice. I grew a lot, So that was basically the beginning of my journey as far as getting into the medical. It wasn't easy, but
wow. It sounds like you're very fortunate, especially like I said, being in that setting, being in this healthcare setting, at least then you started to kind of know the language and you started to know how things function and operate. Okay, awesome. So time for boards. So by the time you finish from when you take your boards down, how long is that a span of 2 years?
So I took my boards within a year. So when I started in 2013, step one, I just went back to back. I took step two immediately, I took CS immediately, and I took step three. So by the time I applied for the March 2014, I had step one, step three, everything ready. And so I applied, and
wow.
I mean, I just said it back to back, but I'm sure you understand. For those that haven't taken it, but it's not just, but it was a lot. Like I shut up from the world, from my family, I was still working because that was the person I am. I had to work. I just didn't want to be idle, but at the same time, I was focused on just getting this done and done. And I learned that after my step one, I tell people this. When I was ready for my step one, I took the NBME or what is called that exam that kind
NBME,
of where you're at. And I was like, I like this. So I pushed my exam by 2 weeks. Big mistake. Because I was at my peak. And with that 2 weeks, it was just, I felt like
burnt out.
Yeah, it wasn't worth the wait. And when I did that, I was like, you know what? I'm just going to go when I'm at my eye, right?
Yeah.
When the step one result came out, I think I scored 216, I believe. I was so proud of that result actually because I'll take it. In my head, I was seeing 261, but that was what it meant to me. I was like, okay, this is all I need. I can do it. And then my boss, who turned out to be my mentor, was like, you know what? First attempt, this is okay.
Yeah.
Go, is to continue to just do better. And he encouraged me. I was like, okay. This is not what I expected, but I'm happy I didn't feel, And then step two came, and it was like almost 20 points up. I got 239.
Okay.
I was like, okay, so I was just like, okay, I think I'm ready for this. And then here is another face-to-face, but because I've been working in the clinic, I was
already had that
interacting with it, even though I didn't do house job by NYC, I haven't practiced medicine. Yeah, I'm used to the American patient. One thing my mentor always taught me was, patient interaction. It was like, that's the key. You cannot be rude. You have to, everything. So I've learned everything. And so the CS was just another boost of confidence because I knew how to type and stuff. The little things that get us.
Flustered,
I think, So again, my job was just one of those. My job, I call it my house job, my NY. It was everything.
It was your training ground.
Yes, it was, So I took the CS pass and I was like, okay, wow, what am I waiting for? Step three, So I just enjoyed it. And so I locked everything out and I was like, okay, now I'm ready for, the interview. So step three came, I think I got 229. Okay. So I told my friend, you know what? I said I can explain my 216, That's what I mean. So, and it's always been family medicine for me.
So that was your first initial what you desired.
Yes. Always has been, outpatient. I didn't like the hospital. I didn't like sickness. I just wanted an outpatient, relationship with my patients. So that was the whole journey in a nutshell. Of course, there were, tears and a lot of, frustration that comes with it financially, emotionally, but it's just one of those things I know I needed to do.
Okay, so you had mentioned before that you were newly married, came to the United States. I mean, how did your husband cope with this part of you that needed to just focus? And I'm guessing that at some point you thought of maybe starting a family. Like, what did that factor into your preparation?
So that's a funny question because, I always wanted to start my family. That's the reason I was leaving school to come to the US, and then it wasn't even my husband, my parents back home, family, like, it's your time, and like, our Nigerian people. Yeah. And then I have to put you on the spot here. I had that discussion with you, and I always thank you for that because not everybody is going to be comfortable telling you the truth. Yeah. And at that time, I know we're talking. I don't know what brought it down. You were like, wasn't fair. maybe just pause on kids and just get this done. The way you presented it made sense. It was what my husband was telling, like with kids, you can't control her stuff.
No, you can't.
You really want to do this, just get it done and then kids can come, bringing a kid into this mix, like this exam is. And, we discussed it and then you just gave me, you had kids, of course, and you gave me like this advice that not everybody will be truthful. It's about, you have to wisdom. And you say that. I'm glad I listened.
I'm glad. I'm honestly really glad you did, because
I'm glad I listened.
You were coming from a place of personal experience where,
I was like, this is not just somebody talking.
No one told me.
And I have studied bodies then. We would study together, and some days I come online and they can't make it. Kids. I mean, you are a mom.
Yes,
and so like
they're there. They're there.
I'm like, if I can avoid this and just pause, maybe I can just focus on this thing I want now, and the others will follow.
Yeah.
So as soon as I was done with step 3, don't tell me don't ask me out, 2014, I got pregnant, so I was planning on doing my family. Like, okay.
Oh wow.
That I just had to sacrifice that, or let's say just prioritize first.
Yeah, very important. Like I said, I learned hard from experience, because when I was preparing my boards, I was so sick during my pregnancy, right? I think these are things you don't know, right? You've never been pregnant before, you don't know if you're the strong, healthy type. So that kind of also delayed my preparation. And so I took my step 1 when my daughter was 6 months old, and so in between. And when you transition, especially if you're a fresh generation here, you don't know anyone here. There's no mommy coming to look after the baby for you. So it's you, right? And so, but I'm glad that I'm honestly so glad that you listened, and I'm glad I was there to be able to give you that advice. Okay, so we're done with our boards. How did the application process go for you?
So like I said, I had my letters of recommendations while working. So my boss at that time happened to do inpatient as well. So sometimes I would go with him to the hospital for rounds. He did nursing home rounds. So I was familiar with everything.
Oh, wow.
So those experiences helped shape, my application and my personal statement. And then he introduced me to his friends at teaching hospitals. Then I was in Texas,
Yeah.
So, I took like 4 weeks off to do like observership at UT Health, I believe, and another private practice. So I had all those while working after my step. So by the time application came, I had my letter of recommendations, and I was very specific to my, the people that are writing my letter. I told them what I wanted, what specialty I was going into, because the 2 other attending at that time, they were internal medicine. So I told him I wanted family medicine, and even during the course of the observership, I was talking to them so that they remember and know who I was and what I wanted. So I was like, see, I'm coming to this, nephrology clinic, or but this is what I want. I want to be family medicine to prevent these patients from getting into that. It sounds just like going in that route, and they're like, okay, yeah, So when it came time, I reminded them and I told them, they should really gear my letter towards, outpatient preventive care, family medicine. So I was intentional about that, even though I didn't read it, but some of my interviews I went for, we had strong letters of recommendation. So I knew they must have put something. And this was hard work I put into it. So I want to always encourage people, whatever you do, give it 100%. So even if it's a day, show up on time, leave last. Even when somebody tell you, oh, you can go, we're done, but always ask them what else. And not just if you're attending, you're working with the nurses, the medical student, everybody around there, give it your 100%. Same thing I did at my job, it was 100% for me. I was always there. I didn't care if, this is just a way to somewhere. And dedicated to that, and it really helps shape who I am as a physician at this time, so I get to see everything of how I practice operates and all that, so again, my letter of recommendation, and then my personal statements, again, I had advice from great people like you. And so I made sure that, the programs I applied for were the ones that were IMG friendly. So I'm a US IMG. But I looked through I had time. I had to research every program because it was a lot of money. No, just waste your money just because you want to apply, just because the program says, they give visa or they're IMG friendly. I looked through every residence to make sure I see people that look like me, and make sure it was also a great fit for me as well.
Yeah.
So I read through their website, and then I would personalize my personal statement to each program. So I personalized the statement to almost 10 programs that I loved so well.
Wow.
Personal statements. At the end of each paragraph, I would say something specific about the person.
About them.
Yeah. To write that as well. And so when I applied, it was a waiting game. I applied to about 100 and maybe 120 or so. I can't really remember family medicine programs. And I got 5 interviews.
Oh, wow. Okay.
So during that season, I think 2 of them were in Texas, 2 of them were in New York, and 1 was in Chicago. And at this time, I was pregnant during that season. I wasn't really showing. So the first interview I went for, I didn't mention anything because they didn't really ask. And when I left that interview, it was really great, everything. And I was like, maybe I should have mentioned it. This is something huge. I don't want to show up here with a baby if I'm actually I need it,
Yeah.
I was just not comfortable with that.
Yeah.
When I went to the interview, they actually brought it up, have a family. And I was like, oh, I'm actually expecting. And that interview just went.
Wow.
And I felt it went downhill. It was God, do you have support? Do you have this? It's your first baby. Can you, it was just, and I was like, oh my God, why did I do this to myself?
Yeah.
Nothing else. It was just that. I'm not in a good way.
Oh, wow.
And I felt horrible. I went to my just crying. I'm like, geez. And so when I went for the last 2 interviews, my spirit was just like, you have to. I mean, I know this is residency, but you have to find a program that will support you.
You absolutely do. Absolutely.
So I was scared. I was like, to hide it. And my spirit was just like, you have to say it.
Yeah.
So the program I finally matched, which I ran first, I told them, I was like, I'm expecting my first baby. And immediately their eyes just lit up and they called a resident who was pregnant. And they were like, yeah, this is her second baby
on the program.
They told her to take me around and, show things how she coped. And I was like, wow, the difference was just
night and day. Yeah.
And so we connected with that and they asked, other relevant questions, of course, and had nothing other than support, So when I went home after I was done with all 5 interviews and, it helped me rant.
Yeah.
I'm glad I mentioned it. I just left the rest for God and pray,
Yeah.
Everything looked good. Everything looked nice. So I'll stop. I know we want this so bad, but you also have to know that these people want you well.
Yeah. True.
Find the one that is best fit for your situation.
True. So that's awesome. It sounds like you. So I'm guessing that you did match that year at that program.
Yes, I see.
Awesome. So how was your residency program? How did those 3 years go for you?
I have to be honest. My program is one of the best. I have colleagues. I mean, who share their stories, and I'm like, I don't think I would have survived. Mine is different. My program is in Utica, New York. Those people were nothing but nice. And I went in there with, these people gave me an opportunity. I'm pregnant, I'm Nigerian with my thick accent, all this stuff. I know, I have something, but I'm like giving myself reasons why they could have told me, I'm like, this is an opportunity for me to pave way for somebody like me.
Yeah.
I don't want to be that resident. They gave me a chance to be like, what, she was so lazy and she was giving an excuse because she was, So I was like, I had to work really hard and they were so supportive.
Yeah.
And I'll tell you how supportive they were because I gave back to my baby May. We started residency in June.
Yeah.
So my baby was just 2 weeks old when we
wow.
Utica. And so childcare, breastfeeding, and they worked my schedule so that my first 4 weeks was, I think, elective.
Okay.
And then they made, they just made it work. And they actually called me, even when they like, when are you going to be due? And they made it work for me. I'm like, wow.
That's awesome.
So they were just so supportive. And I think they were supporting because in 2000, I got pregnant again. So I gave birth to my baby. And my second child, 2016. But I tell you what, again, I think those challenges made me a great resident because they'll be like, if she can do it pregnant and breastfeeding, I wasn't going to let that be an excuse for why I wouldn't show up or why I have to do this because I wasn't that person.
Yeah.
With the in-house examinations, I was, on the top. And then I think working in a clinic, I had this confidence of, how to talk to patients,
patient interaction.
And it wasn't like a big deal with my program because I was always there. It didn't matter. I was always that resident. I was either pregnant or breastfeeding. I had to back, but I was everywhere where I was supposed to be. And I had a lot of support. My first year, I would say I went in there with like an open mind. This is the first time I'm actually practicing. I never did that, So even though I had all these experiences, I went in there ready to learn. And so I think that helped a lot because I was like, first year is the only time I can ask stupid questions.
True.
So I went in there like medical, and I asked questions with the nurses on the floor. My second year, my third year, my preceptors, I was soaking up all the knowledge I could soak up. Because I felt like I had to catch up. I felt like I missed on house job. I felt like I missed on, NYSC,
the actual doctor training.
Yeah. So I was like, okay, so with the little skills I picked up from my work with my boss, I was like applying it and just asking questions. And then, of course, with the knowledge from medical school, I was using that to build. So I came in with a clean slate and I soaked up as much as I could. And then in my second year, I just kept building on it and building on it and building on it. So all I can say is with a lot of support. The program is great. Zero tolerance for, anything crazy. The program director was just always there. He was a father. And he was a good person, so I was very comfortable with talking to him about anything. And so even with when I got pregnant, my second year due date was 2016, December, I was like, I want to graduate in my third year. I don't want to be that resident that takes extra 3 months. How can we make this work? Okay. We worked out a schedule, that I didn't have maternity leave or anything like that, but I was working from home.
Oh, wow.
I did a research, 4 weeks elective with a research on hospice care and palliative care. So I was able to work with an attending for 4 weeks. And then rest 2 weeks, my husband took time off our baby, and then 6 weeks off to take care. Daniel. So it was a struggle. I'm not going to lie and say it was easy. Again, this wasn't planned. It just happened. And, when God makes some things like this happen, my husband and myself were like, what is going on? I cried when I found out. I was like, I'm supposed to be celebrating. This is joy. But I'm like, you think I'm taking advantage? I just felt but I just told God, I'm like, just give me the strength to do this, So that's so maybe that's why I can't really remember much. I was just grinding and taking care of babies.
Oh, wow.
Awesome program. I'm not this is different.
I'm really glad about that because it sounds like God just put you in the right place for that to happen. And it sounds like your husband was also pretty supportive too.
Oh my God. He was he was the one that physically raised our kids, and
oh wow.
I would say breastfed them like he was he gave out like he knew everything, the color of their poop, urine, like he was just there. And there's no way I could have done that without him. I didn't have my parents here, no siblings. No, it was just two of us and the babies. Great colleagues, because some days, when the daycare, you get a call from the daycare,
Yeah.
And then our colleagues who were off, they'll be like, don't worry, I'll watch your baby. So we are still friends still now.
Oh, wow.
we just supported each other. And I think that's what it's all about. When you
Yeah.
have a team of residents,
Yeah.
we're like siblings, we understood each other's struggles, and they were just there to really help. So I thank God for that support.
That is really awesome. That is really awesome. I'm so glad about your experience, and thank you so much for sharing your journey. Now, what just wanted to just quickly ask, what do you think? What do you wish you had known before you started this journey that you think may have made it easier for you?
Yeah, definitely finding out. Especially those of you that already know that you want to come to the US, and I don't think it's too early to start.
Yeah.
So anybody listening to this program who hasn't written, you're in the best place, right? So get contact information from people from your school who are here already, because every school is, different with, their document type and how, stuff like that. If I had known that information, I would have wasted a lot of time. I think I wasn't serious. I don't know. I don't think I was that on that.
I think you're in your honeymoon phase.
I was clueless. I thought about just fun, and I wasn't prepared. I wasn't prepared. If I had known, again, I think maybe it's a blessing in disguise. But yeah, that's really where the majority of my challenges
came from. Yeah.
After that, once I set up the right community, met you, those that have taken it and just followed guidance, it just became easier.
Easier part for you.
Yeah, that was really the easiest part for me. I think the pros for me were just because I think I didn't have to worry about the visa issue, because I know that's a big deal as well.
Yeah.
Yeah, and of course, I had my husband who was just supporting financially, because that's another stress source. I mean, there are times I would look at this piece, I'm like, oh my God, it was a lot. So I think people should always estimate that the cost of this journey, plan it so you're not, frustrated along.
Yeah, absolutely. It's an expensive journey. Like it's an expensive, and then I say when you factor into it, when you come here, and then thankfully, like I said, where you are working, the advantage was that you were working with a physician, so he understood your journey, and so like you said, he gave you time to read. Most people do not have that luxury. Once they start a job, it's like then they try to figure out how do I work, make money, and how do I study. And I guess sometimes that also makes some people's process a little bit longer, because they can't devote 100% to studying and 100% to their job. Yeah, so that sounds like you're pretty much lucky in that aspect. So I'm glad.
And I think things work differently for different people. Like some people need 8 hours to study, some people need 4 hours. Like everybody's different. You really need to know what works for you, and just follow that. I work well under stress, a little bit of time limitations. So again, one of the greatest things that can happen is taking that exam without distractions.
Yeah. Awesome. So can you just leave one tip that you want to leave for any IMG that's listening today? Just one tip that you wish, that helped you and you wish someone else knew about it.
This is the same tip I apply, to everything in life. And that's the self-discipline. Because it's very easy to be carried away.
It is.
Self-discipline is very, very, very important. Consistency. So even if you're able to do 30 minutes today, 1 hour tomorrow, some days are bad, some are going to be great. You have to be consistent. That's the sacrifice that comes with it. And make sure the last one is going to make sure this is something you want, so your passion. But that's what help you. And make sure you're doing this for the right reason. Make sure this is something that is worth it. Yeah. Those 3 things are really things that help me through those difficulties, those lows where you cry and stuff. Yeah. These are the things that really helped me, through everything I do.
Yeah. That's awesome. Well, thank you so much. It's been amazing working with you through your journey, and I'm glad that you're able to share with us today. And I know that someone listening to you is going to get something valuable. Yes. And that if you don't mind, if that's okay, do you mind sharing if someone wants to contact you, how do they reach out to you to ask any questions or just to kind of get some insight?
That would be social media. I'm very active on Instagram.
Okay.
It's Dr. Ufot, at Dr. Ufot That would be the best place.
The best.
Yes, so that would be the best place. You can DM me and I can exchange cell number, email, whatever you want.
Okay, thank you so much. And for those of you that also want to join the conversation, that recently opened a Facebook group, Foreignmd. And so I'm going to post the video up there also, and you all can ask questions about her journey. I will be glad to get back to you on that. So thank you so much. We appreciate you, Dr. Nkem. I'm wishing you all the best.
Thank you for having me.
Thank you.
I hope you enjoyed today's episode. Please share, like, and subscribe to encourage a fellow physician who is also on this transition journey.